Well, I'm born and brought up in Orkney, and I've lived here for the majority of my life, and I can say with total confidence that the new hospital project is the biggest building project that this island has seen in my lifetime, for sure.
So I joined NHS Orkney about 8 years ago, and when I joined the board, the discussions about a new hospital were probably about 30 years old. I knew that the Balfour Hospital, whilst it was in great condition for its age, it needed replaced.
First built in 1934, and various extensions and alterations over the years, and quite a lot of that building is now probably not fit for purpose.
So we're actually investing in a project that will actually allow us to take money out of old buildings, but really importantly it was about local services where we could appropriately and safely deliver.
It's a small community, there's 13,000 stay on the mainland, and it's amazing how many people know someone who's working on the project.
As someone that lives here, it's really nice to be able to be involved in doing something that is such a big importance to the locals.
Well, it's really a privilege to be involved in such a major project to the island, and something that's got to be with the island for the rest of my life anyway.
We've seen it for the very start, which for me has been amazing because I've never worked on a project like this before. So to watch it from the start and as it's gone on, it's been invaluable, really.
I think from Robertson's point of view, the commitment for this project was extensive. We'd met representatives of the client, and we were clearly impressed with the vision they had for delivering this type of facility, and it certainly matched a lot of the kind of skill set that Robertson as a business had.
I think it's vital that the project was felt to be part of the understanding of what Orcadian life is, its heritage, its grey and its context. Skara Brae was, I suppose, the most obvious reference point for us. They built things in a way that defended the accommodation from the elements, going all the way back, you know, having it curved and drawing you into a central space that was protected.
The inspiration for part of the shape of the building was the broch, which was a safe place, a place of safety in times of trouble. So the building to a certain extent echoes those concepts. The main driver for the design, however, was the ability to be flexible.
So at the minute we've got rooms that are specifically for maternity, specifically for Macmillan. We'll be able to use those rooms more flexibly and work across the departments much more easily and much more freely than we can at the moment.
The range of services that this hospital provides to avoid having to take people off island is just unique. Primary care, acute care, social care, palliative care. You know, the local dentist is based in there as well. It really has everything for everybody on the island.
Logistics is king. What has to be dealt with here is how do you get the materials to site. We're in an island location, there's only ferry transport to get materials backwards and forwards. The M&E installation here is very modularised, so we're really committing to getting everything in the right place first, making it in the factory and then shipping finished product to site to install.
Yeah, there were several hundred horizontal modules going in the building, and the first of the vertical modules that went in the building today.
So we're standing here now, and this is the mock-up room. The rooms are designed in such a way that the consultants can carry out small minor ops, minor procedures in the room, rather than maybe having to take the patient from the room into the theatres or into a treatment room.
The way in which this gorgeous facility is designed captures the imagination of modern medicine going forward. So not just in the here and now, but very much about the future.
In terms of looking at other aspects of building, what is interesting is that the energy solution for the building is essentially all electric. We are using renewable energy sources, so actually unique in terms of the all electric concept, unique in terms of the ability to potentially have a carbon neutral hospital, potentially one of the first in Europe, we understand, and also a range of other sort of energy technologies that are being introduced as well. Very innovative at that level as well.
The one thing that stands out for me of all of this is the way the Robertson's team have come into the community, their attitude and their obsession with health and safety is amazing and very, very impressive. Obviously, Robertson's FM will manage the contract and everything will be done through their help desks. So the various pieces of technology that we are going to benefit from now as a board.
It was very, very important to us to have a partner that we could trust. I think the whole work that they've done around community benefits has been fantastic. I know the community in terms of local trade, local employment has been really significant. So all these things actually make me feel really comfortable.
Great healthcare projects are a mix of two things, pragmatism and inspiration. If you know it's going to work, you can then concentrate on those intangible qualities that a healthcare project needs to have. How does it make you feel, the experiential aspects, not only for patients and visitors, but for staff as well. It's a credit to everybody involved in the project, including the client, and perhaps even more especially the client, that we were into that level of discussion about the slightly more inspirational aspects of it earlier than you would perhaps have expected.
I think this isn't just a legacy project for Orkney. This is a project that people will come and visit. They will visit this fabulous facility, but they will also learn from us in the way in which we deliver care. And this has just delivered, on a personal basis, everything that I could have wished for as a patient and as somebody who lives in Orkney.